Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. Tell me about your company. That's what they start thinking is it's the permission for them to start selling. Oh, we've been in the industry for so long. We accept Medicare. We provide, home nursing, skilled nursing, physical therapy, occupational therapy, or if you're a home care company, we provide homemakers, caregivers. We do light housekeeping. We have quality nurses. They're trained. We're licensed, bonded, insured. If you need us, just give us a call. I'm ready for you. Just give us a try. Here's some pens. Here's some mugs. Blah, blah, blah. And that is what every other 99% of home health marketers will do right away. Here is what you should do actually. The moment I hear somebody ask me, tell me about your company, I'll say Mr. Tim or Mr. John or Mr. Smith, whatever. Thank you so much for asking for that. Before I tell you more about my company, I definitely want to be able to know more about you. What are the 3 things that made you choose to work with the agencies in the past? I'm going to ask that question because once again, qualifying doesn't mean that you qualify yourself. Qualification is to be able to qualify them to work with you. And by me asking what made them choose to work with agencies in the past, if you hear that past, I'm putting the current agencies they're working with in their mind in the past. The main part of the question is what are the things that has made you choose, right? I'm trying to find out their buying criteria, their decision-making criteria of what made them choose to work with other agencies in the past. Is it because they started working in this facility and the facility was already working with those agencies? Or are there certain things that the agencies are doing that has helped them and that they love and they want to be able to work with those agencies? Right? What are the buying criteria? What will make them choose a home health, a home care agency to refer to? Once they share that for me, I'm like, oh, thank you so much for sharing that with me. The next thing I'm going to ask is this. I'm like, great, thank you so much for sharing that with me. I truly appreciate it. Now, if the agencies you're working with can do something to improve on, to provide better care for your patients, but take care of you, what would those be? I'm going to ask that once again. I'm going to ask it again. I was wondering if you can share with me, what are the 3 things that if the agencies that you're working with in the past or current can improve on to provide better care for your patients and take care of you, what would those be? Now, as you guys can see, is technically I'm trying to ask them the question of what are those agencies doing wrong? I can ask that. I can say, hey, what are they doing wrong? What are their mistakes that they're making? Now, if you go negative that way, what can happen is you're pretty much telling the social worker, well, you made the decision to choose these bad agencies. So, what's wrong with it? When you ask what can they improve on instead, it allows you to not, position yourself as being a negative person about those agencies because nobody likes a person being negative. But at the very same time as human beings, what makes us move is pain and pleasure. So as you see, the first question is what made you choose? Pleasure. Finding out what the agencies are doing wrong, but asking the right way, allows me to know what their pain points are. What are those agencies doing wrong right now? And the truth is, if you really concentrate on what those agencies are doing wrong, when you're doing your presentation, you are more likely to get the person to move to your agency. And this is where the importance of having knowledge, of having information when you're talking to these people. So by me doing that, I'm like, hey, what are 3 things that they can improve on to provide better care for your patients and take great care of you? And if you hear that again, take great care of you, right? Because I'm making it about them, about the social worker, the referral source, not about the patients right now. Referral source. Because yes, do I want to provide great care to patients? Of course I do. That is a given. But your job as a marketer is to take care of the social worker, not the patients, right? So how do you take care of them is the most important thing. Now, if you can see that when I ask the questions, the pleasure and the pain part, I'm asking 3 of each. So guess what? Now You have a structure for your presentation.
Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.